Gonna start.
Just look at the camera.
Mm-hmm. Mm-hmm. We're waiting for the camera to click up. There we go. Hello. Good afternoon, everyone. Yes, welcome to Ask a Care Navigator, Mondays with Maureen. We're delighted that you joined us today, February the 7th, 2022. I'm Maureen Williams. I'm the Director of Care Navigation at Four Seasons. And this is my colleague, Jenny Martin. Say hello.
Hello. Hello.
And we're going to be hearing a lot more from Jenny here in just a minute. Today, in the month of February, actually, I decided to choose topics close to my heart. So it's Heart Month, so I had to work with that. So our topic today is about Four Seasons Home Care. As always, with all of our conversations here, if you have any questions about Four Seasons or any comments about our topic, you can drop them into the chat here if you're live now or later into the comments box. You can call Four Seasons at 828-692-6178, or you can go to our website, www.fourseasonscfl.org. And we're always happy to get back with you. So today, live or later, we're going to have a conversation with my pal, Jenny Martin, whom I've known for over 8 years now. And so, Jenny, tell us.
Has it been that
long? It's been that long. I know, wonderful adventures we've had together.
Yes, ma'am.
Tell us what you're doing now here at Four Seasons.
Well, I am the recruiter and the trainer. I train all the new caregivers who come in and make sure that they know what they're doing when they go out to see our new clients.
Wonderful. And that specifically, I didn't say it. Did I say it was for Four Seasons Home Care?
Mm-hmm.
I did. Okay. Because we have several service lines, and Jenny's in our home care service line.
Yes.
Absolutely. Well, what we want to talk about is what home care services are. So tell us about some of the reasons, Jenny, that people might want to engage home care services.
Sure. Some of the reasons are we have people who are at home, daughters or sons that are taking care of their family members, mm-hmm. and it becomes overwhelming, and so they look for additional or supplemental support. We have some clients who need help that their families live out of town, mm-hmm. so they call us to ask to be that supportive presence and come out and help them in their home that way. So those are a couple of
those are good
examples.
reasons.
Yeah.
In fact, Jenny and everybody else, those are reasons why care navigation gets involved too.
Exactly.
The same exact reason.
Exactly.
So that's great. So tell us about the kinds of home care services that Four Seasons Home Care offers. Tell us what your caregiver team does.
So our caregivers go in and they help with our clients who need help with bathing, mm-hmm. or they need help with ambulation, even just simple things walking around your home. Grocery shopping, errands, doctor's appointments, some light housekeeping, some meal prep, those kinds of things.
Will they transport people to those medical appointments?
Yes, absolutely.
I love it. Will they go to the grocery store and run errands too?
Absolutely.
Oh, I love that. And also, I believe you all do just companion-like services
We do.
too.
All of our caregivers are trained to do all of the same tasks.
Okay.
However, we do have some requests from some clients who just want someone to be there and be that supportive companion, get them a drink of water, or just to play cards, or
mm-hmm.
to work puzzles.
I love that.
Just to be there with them.
Yeah, I want to be a companion that works jigsaw puzzles. I love them. That's great. Well, how can anyone watching right now be confident in the caregivers that Four Seasons Home Care might match up with them?
I do a pretty strict interview process. I don't hire just anyone. We want to make sure that the people that we hire are going to be a good match for our agency. They go through the interview process. We do a full, complete background check. We do a drug screen, and then extensive training during that orientation day.
Well, tell us a little bit more about that training. What kinds of training do they get?
So we do, of course, a lot of literature and a lot of lecture stuff, but then also training on how to give a bed bath, training on how to feed someone, how to help someone walk with a walker or assisted walkings, how to use a sit-to-stand or a Hoyer lift. Not as much in great detail with those because it's a very specific task for individual clients, but we do give them all of those tools.
And I'm sure you all talk to them, you said in the lecture part, about things like emergency protocols,
Absolutely.
or what a DNR is, or a MOST form, or what to do?
Yeah, we talk about emergency protocols. The DNR and the most are a little bit more on the hospice end, but
True that.
and the nurses, if it comes up, the nurses will talk to the clients about that.
That's great, because I think those things are important. You know, who to call and when, right?
Absolutely, and with every caregiver, they're all given a list of emergency contact people, the fire department, the hospitals,
Right.
and then the clients have that in their home book as well.
I love that. And I bet your caregivers know who the lifeline is with Four Seasons Home Care, right? Someone's always on call.
Someone is on call 24/7. We are always available.
I love
We are
that.
always available.
It's important I think it's important for everybody to feel confident, not only in the caregivers, but in the agency that's employing the caregivers.
Absolutely. We will answer that phone. It will never go to voicemail. And if it does, it's a very rare occasion. We may be on the phone with
Someone
another
else.
client or another caregiver.
Yeah, and
Absolutely.
I've tested it. I've called them after hours, too. Well, how is Four Seasons Home Care Services paid for or funded? Who pays the bill?
So this is not a Medicare covered benefit. So I wanted to make sure that we communicate
Yes.
that. There's a lot of misunderstanding.
And not Medicaid either.
And not
Okay.
Medicaid either.
Okay.
And home health is very different from what home care is.
Talk
and
to
so
us.
Home health is wound care and catheters and administration.
Right.
We don't perform this right now. We don't perform that. It is coming soon, but we don't perform those tasks right now. It's paid for either by long-term insurance or by private pay, or if they have veterans benefits.
Right.
So those are the three sources.
And may I toss one in? And I've shared this before with this group. Just like Four Seasons Care Navigation is now the beneficiary of a grant
Yes.
for people who can't afford to pay.
We do also have the Julie Brandt Fund, so we have been able to, and in fact we do have a client who's utilizing that service
Right.
now, who does not have enough money to pay for all of their service, so they are able to access that grant to help supplement those funds.
And Four Seasons, many of you know, we provide our hospice and our palliative care services regardless of ability to pay.
Absolutely.
And now we're able to extend that philosophy, that culture,
Yes.
to our home care clients and our care navigation
Right.
clients. Thank you for letting me add
You're
that in there,
welcome.
Jenny. So how do we begin services? You know, do I need a doctor's order?
You absolutely do not need a doctor's order. It's a matter of calling us and telling us what your need is, the location in which your family member or yourself live, so that we can know if we have caregivers in the area. But you absolutely do not need a doctor's order. This is strictly a family decision.
So we could just pick up the phone and call
Pick up
you.
the phone and call us.
Wonderful. And just say, here's what we need help with.
Absolutely.
Wonderful. And then once we pick up the phone and call, you'll have an intake screening process?
We do. We ask
Okay.
several questions. We ask about a diagnosis. We ask about what the needs are, how severe is, maybe someone has dementia. How
Right.
severe is the dementia? Maybe someone is partially ambulatory. Well, what is the extent of that ambulation, so that we can know how to best serve
Right.
that client and match up a good caregiver who's got that
Right.
knowledge and that skill.
And then
with
someone
them.
goes to the home too.
And
right?
then we send a nurse out to the home, and they do the admission. They ask a series of questions. They get the medications. They ask what kinds of things do the clients want the caregivers to do during the shift. And then the nurse creates a care plan, and that's what the caregivers follow.
I
And
love
if
that.
there's ever any question a caregiver has about a care plan, they know that they can call us and talk to us about that.
I like that. And just those of you who are watching, if you ever engage home care services, the more you can share with the home care provider
Absolutely.
about what this person's interests and likes are and quirks and hot button topics, that
Yeah.
crafts a better care plan, doesn't
In
it,
fact,
Jenny?
yes, absolutely. We have in the front of a new client's book, there's a page called About My Life, and it's a full 8.5 by 11 page, and it asks several questions about what are your favorite hobbies? What is something that you really enjoy doing? And so it allows the caregiver to fill in as they go. And maybe it's not the same caregiver each time, but they can refer back to the list and say, oh, you know what? I know you really loved gardening. So tell me about what you loved about gardening. And I love gardening too. And it's a way to communicate, and it's been a very, very effective tool.
I like that. That's very attentive to the client's needs, not ours.
Absolutely.
Yeah. So a lot of people may be asking, some home care agencies require a minimum of 4 hours per shift. Tell us about the shift requirements.
We have a 1 hour minimum.
Yeah,
It's
very
sometimes
unique.
it's very unique, and it
Yeah.
sometimes can be a challenge to fill. But we don't have a set 4 hour, 3 hour, 2 hour.
Right.
The minimum is an hour. Yeah.
That's very unique, y'all. It's again, we're all challenged right now finding caregivers, aren't we?
Oh my gosh.
Tell
yes.
us about how you can become a caregiver here, Jenny.
Please come see us, or go online and fill out your application. It comes directly to me. I review it right away, and then I can start making calls, and we can set up an interview. But you can either come down to our office and fill out a paper application, or, as I said, you can go online.
And just, most of us in our business know that there's such a tremendous caregiver shortage nationally. Nationally. It's not just here, it's across the board.
Absolutely.
So, what do we offer to people that would make them want to be a caregiver with Four Seasons Home Care?
Well, we offer starting wages at $15 per hour, which is very competitive. We offer free telehealth, which is...
This is huge.
This is enormous.
And I've used that
I've
telehealth.
used
Yeah,
it.
it's great.
I don't think there's anyone in specifically in our office, but I know there's several caregivers who have also utilized that service. What a blessing it has been, because as you know, we all get sick and we don't feel well enough to go to a doctor, or maybe we don't have a primary doctor, and this doesn't take the place of, but it's a really good second. You can either video chat with them or just on the phone, and you're talking to an actual MD, and he will determine what needs to happen.
Yeah.
You need an antibiotic, you need a steroid, and whichever way he goes, it's either a free medication or it's really low cost.
Yeah.
So that is
that's a benefit.
Great benefit. If it's something serious, he'll or she will tell you where to go. I feel like you need to seek out a primary doctor, or you need to go to an emergency room. So that's one wonderful benefit that we offer on top of the 15 per hour. Caregiver appreciation days, which we love our caregivers. They have made the business for us, and if we don't have those caregivers, we don't have the clients, and we can't grow as a company. So it's for full circle.
Yeah. Keep talking, because my
Sure.
screen just went blank.
So the Caregiver Appreciation Days, Employee of the Month, Employee of the Year.
A year.
So we do that, and then their picture gets printed and put up on the wall so everyone can see.
I saw it today here.
And if you are employed and you work an average of 40 hours a week consistently for a year, you will be eligible for medical benefits.
That's another big plus.
Absolutely.
And I don't know about you, Jenny, but over the course of this pandemic, Four Seasons is taking care of its employees extremely well, not just with these benefits, but with other very special things.
Well, that's why we're here as long as we have been.
Yeah.
You and I, I've been here almost 13 years, and it's been a blessing. And to stay with a company that long, they have to do something right.
They do.
And the people that you work with, and I'll say for home care, this has been a huge blessing in my own life, to work for an agency as such, to have the people and the support you need to do your job well and feel confident in what you're doing.
It's so true. We've got a comment from someone who's about to graduate with her CMA in work. Please, and our hospice made an impact. Thank you, Catherine. Thank you very
that's
much.
Wonderful.
Yeah, she wants to bless others as you were blessed when your
Come on
husband
down,
passed.
Catherine.
Come and talk to us, Catherine.
Yeah, we're
Please.
ready. It's great that you have your CMA.
That helps.
It does help to know what to do. We can't reflect much difference in salary, but we can talk about that.
Yeah.
But we definitely come down and talk to me.
Yeah, perfect. Thank you, Catherine, and appreciate your testimony about how we helped you with hospice care, and we're honored. Jenny and I met while working in our hospice service line,
Yes.
and it's been a privilege. It was a privilege to be of service to all of the people we took care of all those many years.
I've had my own family members on hospice service, so again, it makes a difference, and it again is that blessing.
I love it. Well, thank you, Jenny.
You're welcome.
It's good to work with Jenny. We've worked together in many capacities
Yes, we have.
for the last 8 years for me, but Jenny really has a huge heart of compassion. I hope you can see that. I've worked with her at the bedside, and this is real. This is very real, and she'll take care of you if you're interested in working for us. And especially if you need services from Four Seasons Home Care, she'll make sure that those caregivers take good care of you too.
Absolutely.
So thank you, Jenny. So we create this space once a week to talk about issues associated with aging well and living well. And I think knowing what resources are out there in the community in terms like home care services, that's part of living well and aging well. You may not need it now, but it's good to know that Four Seasons is here, the care you trust. So for all of this, if you want to drop in comments later after we stop being live, please do so. We will get back to you. But please call us at 828-692-6178. That's our main number. Thank you, Catherine. And also go to the website, www.fourseasonscfl.org. While our home care service line has a space on that website, click on home care and it takes you to the home care website as well. And Jenny will respond to you right away. Right away. So thank you. Join us next week, February the 14th, another Heart Day. We'll talk about another topic that's close to my heart. You'll see what it is then. Issues associated with living well and aging well. So Jenny, thank you for sharing.
Thank you.
And thank you all for listening. If you're live or later, we're honored to be of service in any way. So talk to you next week. Take care.
Bye.
Bye.